Greetings, everyone. Thank you for joining us for the VTAR webinar on certification standards. My name is Kristen Harper, and I'm a technical assistance coordinator here at C4 Innovations. I will be your moderator today for the webinar. I would like to take a second to say hello to my two presenters today, Jeff and George. So Jeff and George, if you would like to say hello to everyone, just briefly introduce yourselves. That would be great. We'll start with Jeff. I think you're muted, Jeff.
Sorry. Good afternoon, everybody. I'm Jeff Moreau. I'm the Executive Director for the Vermont Alliance for Recovery Residences. I started this new position in April of this year, and I couldn't be more excited to be doing this work.
Thank you, Jeff. And George, I think you're muted too.
Okay, it's contagious. So I'm George Brott. I am the current secretary for the National Alliance for Recovery Residences, and I'm also the affiliates committee chair, and I also serve this organization as the Opioid Response Network recovery consultant.
Thank you, George. Thank you, Jeff. We're so fortunate to have both of you join us today for this really important discussion. So this webinar is an opportunity to hear directly from VTAR and NAR about the future of recovery housing plans in the state of Vermont. If you could take a look at your screens here, you'll see that you'll have a chat box. And I'm going to go ahead and ask Jeff and George to go back on mute now so we don't have the feedback. All right, and it looks like if you're having any trouble with technical, not being able to hear, please go ahead and we will reach out to us and we will get somebody to take care of you. Also, if you would just take a second to introduce yourselves in the chat box, we'd love to find out who is here. Everyone that is participating is going to be on mute. So if you have questions throughout the conversation, we will be able to take your questions and offer answers at the end of the webinar session. So if you want to enter any questions that you may have throughout the conversation, then we will make sure to get to them before the end of the hour. This is a 60-minute webinar. We would love to also let you know that we're recording the webinar, and it will be available to anyone who needs any additional review of the material. You can share it with anybody that's also not able to hear. We encourage you, again, like I said, to submit your questions in the Q&A pod. And please be aware that any comments that you put in the chat box will be viewed by everyone. Please listen to the webinar using your computer rather than using your phone line. If you have trouble hearing the audio through your computer speakers, please request assistance through the chat box, which we've already had a couple of examples of that. If you would like to zoom in on the slides that we're sharing today, you can make them larger with the full screen button in the upper right-hand corner of the display pod. To exit full screen, just press the escape key on your keyboard. This allows you to view the presentation without the pods, or to switch back to the pod view so you can pose a question or comment. This session will last about 60 minutes, and at the end, again, we will be able to answer your questions. You'll also see that there is a poll up here. If you'll take a minute to go ahead and enter your answers into the poll, we'd love to get an idea and a sense of who is joining us today. The question in the poll is, what is your main role related to recovery housing? And so far, we have one entry for recovery coach. And then we'd love to see who else is also here too. So take a moment to do the poll, and we will review it in just a second. You'll also be able to download today's slides and other resources using the file share pod, which will appear later during the presentation. To download a file, click on it with your cursor and then click Download Files. And it looks like we also have a couple more people answering the poll. We really appreciate that. So it looks like we have an owner-operator as well as a couple of recovery coaches. All right, so you guys keep entering in your answers with that poll, and we will make sure to take a minute at the end of the conversation to answer any questions about roles and responsibilities. And again, thank you so much for introducing yourselves in the chat box. And I am going to turn the presentation over now to Jeff and to George. Jeff.
Thank you so much. Did you want to touch base real quick, Kristen, on the Opioid Response Network?
Oh, sure. Yes, thank you. That was in my notes for the slide. Sure, yeah. So we are, C4 operates the Opioid Response Network recovery arm, and so we field the technical assistance request. If you have any requests that you would like to submit, then we will show you the website to be able to do that. Make sure we can include that as resources at the end as well. But we offer technical assistance to support evidence-based prevention, treatment, and recovery of opioid use disorders. And this is something available to anybody that is in need of any kind of technical assistance. Now, Jeff, I will turn it over to you.
Super. Thank you, Kristen. And I just want to say that Opioid Response Network has been incredibly helpful to VTAR as we've gotten started. George has assisted us with Jonathan Cox and others from the organization. And it's a great resource for all of you on the call today to tap into. Really great people that really want to help and make a difference. So a little bit about the Vermont Alliance for Recovery Residences. As you can see, our mission is to support those in recovery from substance use disorders by improving access to recovery residences through established standards, a fair and transparent certification process, community engagement, education, technical assistance, research, and advocacy. I'd like to acknowledge our board members. There are a few that were unable to join us today, but we have a few of you on the call. Peter Mallory, our board president, Eileen Pelletier, our vice president, Nancy Bassett, our secretary, Maria Ogden, who is a state employee, and Angela Zalkowski, another one of our board members. What a great group of dedicated individuals helping us to really lead this important work. So VTAR became an affiliate of the National Alliance back in 2017, and our role really is to certify recovery homes throughout Vermont. And the certification process is voluntary. But we're hoping that the vast majority of homes will want to become certified by VTAR. We also are responsible for fielding a concern process. So if individuals that live in a recovery home or neighbors or community members have concerns about a particular recovery home, if they're not satisfied with the feedback that they've gotten from the home's operator, we're willing to go in and take a look at it and see if there are things that need to be resolved. We're also working on legislation at the State House here in Montpelier to support the work of recovery housing. It really, in my mind, is the next logical step in Vermont's work against addiction. And then the final thing that you see on this slide, there's a organization of all of us that are working to scale up the resource of recovery housing, and it's called Residences for Recovery. And this was an initiative that got started to really expand the number of recovery homes, and there's been some really good work done by this group to document the need. So I like to say that not long ago, folks that wanted to get into medically assisted treatment for their addiction really had a difficult time accessing treatment. And today, through the hub and spoke system, we have over 8,500 individuals that are receiving this support. And we have thousands of other folks that are on different paths for their recovery. And I think that the next logical step is to help these individuals with safe, supportive housing. I think that it's foolhardy to send folks back to the places that maybe fueled their addiction. I think it's more effective to have them in homes that are supported, working with other residences to support one another's recovery. And I think Vermont has indicated their support of this work, and we're excited to be able to really scale up this resource and make sure that it's safe and of high quality. One of the stats that I think people are often really surprised about is we all know that across the country that we have an opiate crisis, but Vermont also has another challenge, and that is we have the 4th highest rate of alcohol and other drug use in the country. And when I share that with folks, I think they're a bit taken back by that. The study that I referenced demonstrates that we're really only addressing about 2% of the population that could benefit from this high-quality recovery housing. So it is time for us to really get serious about scaling this up. So a little bit about certification. I mentioned it's voluntary. We charge $250 as a fee, and the certification lasts for 1 year. Our hope is that in addition to validating that your homes are run of high quality and being able to promote that, that we'll have other benefits of certification. And some of this hasn't been finalized, but we're working very hard to try to make this happen. And the first thing is really trying to help operators with scholarship funds to offer to participants for the first month or so of their obligation in the home. We all know that many folks that are coming into these settings need employment and just need that assistance to get started. So our hope is to create a fund and to be able to award these scholarships to organizations that are certified throughout Vermont. There's also a pilot that's being explored right now to pay for some of the staff time in these homes, whether it's recovery coaching or a part-time house manager through Medicaid. And if that goes well, we anticipate that that might be able to be opened up to other recovery operators. I mentioned earlier that we're working on some legislation at the state level around zoning is one of the things that we're working on. We're working on a common definition for recovery housing. And I would just say stay tuned because we will need your help in talking to legislatures as we get some of that work finalized. Our belief also is that if we're going to refer to recovery residences, we want to refer to certified recovery residences, and I believe that's the state of Vermont's position as well. And I'm sure that many of our partners will want to send folks to certified homes. Any funding that comes in from the state or federal government will have to go to certified homes. I just came back from the National Alliance of Recovery Residences conference, and there's a lot of exciting things happening in Washington to support our work. And a lot of funding is being made available now. So whether it's helping with transportation or treatment or getting some of these homes up and running, there's a lot out there. And then finally, we want to serve as a resource around for all of you to network and to share ideas and to share best practices as we build this out. There was great sharing at the NAR conference, and we really would like to replicate that here in Vermont. One of the ideas that we'll be implementing in 2020 is quarterly, we're going to ask all the operators to join our board of directors, and that'll be your voice at the table, so we can hear your concerns and work on things that are important to you. I mentioned the legislation, and at this time I'm going to turn it over to George to give you a national perspective.
Well done, Jeff, and thanks for your and the other VTAR officers and board members, and I look forward to the continued development of the organization. We've made some significant strides, and this is an exciting time. So I'd like to talk a little bit about this standard that NAR has developed, specifically with regards to recovery housing. Just a little bit about the history. If we start going back to the 1800s, that's when recovery housing really kind of popped up, because a key need in recovery, obviously, is a safe and sober place to stay. So fast forward a few years, and you have the founding of AA and the development of the social model of recovery, which is a contrast to the medical model. It basically says what helps people survive and sustain their recovery is being connected with other people who are on a similar journey, not necessarily the same pathway, but working towards a similar goal. And that, of course, meaning progressive wellness or recovery. And then the formation of the Association of Halfway House Alcoholism Programs of North America really put into practice the idea of incorporating certification and workforce development as formal processes that is essential for really promoting the ongoing development of best practices in recovery housing. So keep going a little further, and you see that in the late 1900s, Oxford Housing started popping up. It's perhaps the largest recovery residence organization internationally. And then there were other groups, like in California and in Georgia, where I am, Sober Living Network out in California, and others, that began organizing recovery residence operators. And each of those groups put together standards and trainings and certifications. And all of that was being done independently until somebody by the name of Beth Sanders had the idea of, how about we pull together all of the resources that these organizations have and form the National Alliance for Recovery Residences. We had an early meeting in 2010 that led to 2011 NAR actually being incorporated as a nonprofit. And you can see we are busy developing materials to assist affiliates and recovery residence operators in improving the quality and the outcomes of recovery residences. So we've got the national standard, we've got code of ethics, we define 4 levels of support, and I'm going to talk a little bit more about that in a moment. And then it's about how do we promulgate best practices. So what's done in Hayhire, Georgia, likely isn't necessarily going to work in Spokane, Washington. And that's part of the challenge of your affiliate, is to really begin to sort through the national standards to come up with how do we implement this in a way within the context of our state requirements and local zoning requirements and other municipal restrictions, so that what we wind up with is really a set of local best practices. And it's through sort of that networking and the technical assistance that we provide to one another that we begin to develop the bonds that allow us to do the advocacy that's necessary both at the state and the national levels to stand up and say, here's the data that shows what we are doing is working, and we're working on doing it better. So we've got 29 affiliates. There's, I would say at this time, about 6 or 7 more that are in the process of becoming affiliates. We have collaborated with SAMHSA significantly over the last 2 to 3 years, and NAR is now recognized as a recovery housing authority by the White House ONDCP. And of course, we work with and support state recovery housing organizations across the United States and with federal and state agencies and other national organizations to spread the word that the continuum of care for substance use services has to acknowledge the vital role that recovery residences play in order for those continuums to be complete. So you can see this map that shows the 7 states that originally came together to form NAR, and this is where we are today. And as I said, we've got, actually this map doesn't really show all of the developing affiliates, but we've grown significantly. And the challenge for us is now, how do we actually go about making the connections within affiliate states as well as between affiliates, because that's where we really find the connections become really valuable. So this all got started because a bunch of recovery operators got together and formed organizations, and they certified their operators according to individual standards. But we pulled all those together and pooled the resources and formed the National Alliance for Recovery Residences. And then ultimately, that led to the development of the standard. And this is what is now promoted and promulgated via the affiliates down to the level of the recovery residence operator. And it really is so much more than just the standard. It's about how do we promote best practices, and how do we monitor compliance, and how do we do ongoing professional development, training, and education so that the quality of the services that we provide continues to improve. So let's talk just a second about the specific components of the standards and the ethics. So this graph, as you see on the left-hand side, shows the service intensity that happens in treatment and in other recovery supports. The intensity goes from high to low, and recovery obviously is a process. It's not an event. But usually that begins with some high-intensity services that over time decrease to produce long-term recovery, which we could just generally define as independent, meaningful living in the community of one's choice. The process for a lot of people starts with acute care. Now, not everybody, and in fact, more people actually get into recovery without necessarily going through some kind of acute care, but that's the predominant place that is promoted as the starting place for recovery. And if we add to that the services that are really essential for support in the community, those are the things that help people move from institutional living into essentially free living in the community of their choice. And this is actually where the vital role of recovery residences are. So recovery doesn't happen in an institution. Recovery can begin there, but ultimately it's about how do we support people's continuing recovery in the community. And it's about developing those networks so that we really do have people who are able to not only sustain their own recovery, but promote recovery for others. And that is what helps people move from early stages of recovery to middle and latter stages. So 5 key elements of recovery residences. Obviously, they all provide some sort of housing. It's targeted to individual substance use disorders, and typically these recovery residences are abstinence-based, specifically with regards to illicit drugs. There's some amount of peer recovery support that's emphasized, and again, this is one of the hallmarks of the differences between the medical model and the social model. And then the community within the residence operates in a family-like way. And this is what distinguishes recovery residences from, say, boarding houses or hotels or drop-in centers or homeless shelters. Because the part of the challenge in recovery is learning how do I actually support my recovery as well as the safety and the health of the residents that I'm living in. So it's not just about me, but it's about me within the context of an internal community within the house as well as the larger recovery community that the house is situated in. So what's a good standard? Well, it defines essential requirements. It's evidence-based. They are observable and measurable. So as we do certifications, there's specific things that we look for. It's somewhat value-free. And so whether your philosophy of recovery is based on disease model or faith-based or MAT or yoga or drum circles or whatever, you are able to still provide recovery resident services independent of that specific philosophy being the only option provided to residents. And then it's achievable. So it doesn't do any good to have standards that nobody can meet. And it's acknowledged by health professionals and other providers who are part of the continuum of care, and the public sees the value that the standards that you're implementing brings to the entire recovery process. So NAR identified 4 levels of service. And part of the challenge when we first got together was there were a lot of names for what we now refer to generically as recovery residency. So again, you can see across the 4 levels of services, there are differences that demarcate which level of service is being provided. So the first level is just an independent house that operates as a support system for people who are seeking and who are in recovery. And Oxford House is probably the quintessential example of a level 1 recovery residence. There's no staff. It's all about how we support our own and other residents' recovery. And then if you move up to level 2, there's typically some sort of formalized recovery support service that's provided. And in this case, it may be certified recovery coaches. It may be that there are residents, once they have met minimum requirements, are allowed to move into house management positions or oversight of chores and those sorts of responsibilities, which again is an example of increasing responsibility and moving to higher levels of accountability, both for my recovery, but also for the health and the well-being of the residents. Level 3, the terms vary. It can be sober living, it can be recovery residences, but here typically there are some formal structured classes targeted towards helping people develop life skills that are offered in these programs. And again, that can really vary widely from certified counselors or licensed mental health professionals. Some of those classes, in some cases, are actually delivered by certified recovery coaches. But the idea is that part of what level threes do is they provide a more intense program that specifically targets the development of life skills. And then the last level, the clinical element is engaged in level 4. This is what we would typically refer to as treatment. So there are formal assessments that are done. Those formal assessments lead to treatment plans and recovery plans. And there's typically a network of service providers who are licensed or certified who are also engaged with the resident. So this is a way of widening the tent so that people who are operating any of the 4 levels of services can recognize where they are in this continuum. And it's not about 4s being better than 3s, being better than 2s, and 2s being better than 1. It's recognizing that each level of service brings to the table an important component of what people use in order to get into and sustain their recovery. So specifically, the NAR standard has 31 elements, and there's 4 domains, and you can see the domains that are listed here. Within the domains, there are about 100 individual factors, and you're certainly welcome to go to the NAR website, or actually you can go to the VTAR website and download the standard. I just want to take a second and go through kind of a high-level view of what's in the standard. In terms of administration, is the recovery residence operated with integrity? Does the resident's rights have a significant place in decisions that are made, and are residents involved in managing the recovery residence? Do you create a culture of empowerment so that people see examples of what recovery looks like in their peers, in the others who have been there longer? And then for staff, do they have professional development plans that are specifically oriented to helping become better over time, or more proficient at working with people who are in the various stages of recovery that show up in recovery residence? So that's the first domain that the standard addresses. Secondly is the physical environment. So yes, part of the site visit process is to see whether or not this facility has a safe and healthy environment. And we're really talking about the physical structure. Are there screens on the windows? Is there smoke detectors? All those sorts of things that are, some of which is required by law, but others of which is just common sense about providing a place that's safe and healthy. And then there's this idea of a home-like environment, and we really have been challenged to quantify what that means. Most of the time when you walk into a building, you can tell whether or not it is home-like just by your subjective or emotional sense of how people are interacting with one another there. So there's specific items in the standard that get to, is this a home-like environment? So the recovery support domain gets into specifically how do you facilitate recovery community engagement that promotes progressive recovery. It's traditional sort of program in recovery says, we've got the answers. Sit down, take the cotton out of your ears and put it in your mouth, and go along with us until you figure out we really do have the answer. Well, there's a place for that, and to the extent that recovery residences are able to model pro-social behaviors and use relationship enhancement skills to build connections with other pathways of recovery, other than what happens within the walls of the recovery residence, is really an essential component of recovery support. So it's helping the person learn how, if the opposite of addiction is connection, how do you do that? Because most of us, when we got into addiction, found ourselves limiting our contacts to only folks who supported our addiction. And often the challenge, particularly in early recovery, is how do I reconnect with folks who are interested in supporting my pro-social development and my reducing or eliminating my illicit drug use. And that is a huge challenge. So part of that process involves helping residents have a sense of genuinely belonging in a community that validates and celebrates the gifts that they bring in terms of skills and abilities and talents and hobbies and all those sorts of things. And as part of that, learn how to accept responsibility for the community's safety and health. And then the last challenge with the standard is good neighbor policy. Part of living in the community means that you got to learn how to get along with other people. And there's a natural tendency in the recovery residents world to kind of want to hide and stay out of the limelight and hope people don't notice you, because NIMBY and other factors can really begin to impact the quality of the recovery that residents experience. So we kind of flipped that on its head and said, so what are you doing that promotes healthy and positive relationships with external groups who will be able to support your organization as allies? And this is not an easy task, but it's one that we believe to be essential to sustaining the quality of the recovery residents, as well as the recovery of the people who live in those residences. So we developed a code of ethics. It's a separate document from the standard, but it is a companion document that is part of what the affiliate promotes to the recovery residents that it's certified. So again, it's about building into the responsibility of the operator, staff, volunteers, contractors, and residents a set of values or standards, rather, that really promulgate the responsibility for managing both my behavior as well as the context of the recovery resident. So how do you do the site visit or evaluation process in order to get certified? Well, there is obviously a formal application process, and you'll be able to go on the VTAR website and pull those down. Initially, the certification committee will do a review of the residents' policies and procedures and whatever paperwork they require residents to complete and staff to complete. So pretty much all the paperwork that is part of operating the recovery residence is grist for the mill, and it's necessary in order to get a real sense of how the recovery residence is operated. And then there's obviously a site visit where there are interviews that are done with staff and residents, as well as just walking around and checking on the safety and the health factors that will determine if you, in fact, are providing a place that, well, the standard that I often think about is, would my mother or my father or my brother or my sister, would I be willing to send them to stay at this place for whatever length of time is recommended? And there's things in the standard that obviously will quantify that, but ultimately that's kind of what it gets down to. And over time, what we recognize is that we started off with, tell us about how you do things. And it really has now resulted in the approach of show us how you do it. Because, people can say this is how we do things, but when you actually look at operations, sometimes there are differences. And so that's really the process of doing the certification, is to learn what you say you're doing and then to go in and see evidence of that actually being operational. So, Jeff, you want to talk some about your recent pilot project? You're on mute again.
Over the course of the summer, we conducted a certification of Vermont Foundation for Recovery. And for those of you that don't know V4, they operate 6 homes throughout the state of Vermont. And again, they served as a pilot for us. They are now certified based on the NAR standards. It was a rigorous process, and we learned a lot by going through it. And I believe we've really simplified and streamlined it for all of you. If you have any questions, V4 has offered to let you know what their experience has been like. And we're eager to start certifying more residences. So other things that you might want to consider doing to get up to speed on certification in Vermont is to look at the materials that George mentioned. We've just revamped our website, and we were hoping it would be live today. It's right in the middle of the transition moment. So you'll notice under the webinar information, we have a temporary site that you can go to. It's vedic.website, and that will put you right into our brand new website. And there's all kinds of resources there, sample policies and procedures, a link to begin certification, national resources, information on how to sign up for the residences for recovery that I mentioned earlier, how to follow us on Twitter, and so forth. The other thing that I didn't mention earlier, but NAR hosts a call every Friday, once a month, from 11 to noon. And these are incredibly helpful. They'll spend the first 10 minutes or so providing an update on what's happening at the national level, but then they'll also have a rich discussion around the topic of the month. So I encourage all of you, if you're interested in this work, to consider joining those calls. They're very informative. George's email is listed on the slide. You do need to register for those calls, just like you did today's webinar, because they've gotten so popular. So with that, I think we're ready to answer any questions that folks might have.
Good.
That's great. Thank you both so much. So let's go ahead and look and see what questions we might have. Again, if you would like to ask a question, please just type it in the Q&A pod. So I think we'll go with the first question for George. Is there a process for assessing the need for housing in a local area that people should be aware of?
Is there a process for inspecting the need for housing?
For assessing the need, yeah.
So one of the challenges that VTAR will need to address sooner rather than later is exactly what is the recovery residence capacity in Vermont. And we have some systems in place that can help with that. So connecting with who you know that operates a recovery residence is the first step. You're probably all familiar with the 6 degrees of freedom, or 6 degrees of connections, or 6 degrees of Kevin Bacon. And so it's really about, so you know people, and those people know people, and their friends know people. So to the extent that you can send your tentacles out and do a sweep to find out, here's the existing capacity in Vermont, that's really a key part of the first year of work for the affiliate. And so, yes, that helps identify not just that there are this many recovery residences, but where they are, and to some extent being able to match that up with demographics for your state to say here are high areas of people that don't have adequate or sufficient numbers of recovery residences is an important part of the strategic planning process. Thanks for the question.
That's great. Thank you, George. Jeff, the next question is for you. Are you aware of any state-level policies that are currently under review for recovery housing?
Yes, we have been working on some legislation dealing with not in my backyard and zoning, as well as how to help support people when they relapse in one of these recovery homes. So those are some pieces that we're working on with a variety of state partners. We're also in contact with some of the state leaders to let them know what we're focused on, to ask for their support and help. So we're attending a lot of meetings around the state on the whole topic of recovery. I do want to go back to the question about assessment of need, and I apologize for not digging into that a little bit deeper, but when I referenced residences for recovery, they've done some great work there. And Downstreet Housing, based in Washington County, has really taken the lead on a lot of that work. There's a comprehensive assessment of what's available for recovery housing, the types of recovery housing in Vermont on our website. So again, if you go to the Vedic.website and then today and then tomorrow, after that you'll be able to access it through VTAR. You'll see a report that was created. It's called Housing a Critical Link to Recovery. And it's a 200 some odd page document, so it's very thorough. I believe it says that there are 212 recovery beds currently in the state of Vermont. There's about 20 or so operators. And as I referenced in my early comments, that's only addressing about 2% of the need. There literally is nothing below Chittenden County on the western part of the state. So Addison County all the way down to Bennington, we have no recovery housing. I know Kevin Loso is on the call, and he's very interested in looking at Rutland and doing some work there. Our friends in Springfield are also interested in doing some work down on that side of the state. And Windham County is looking at this as well, all areas that have gaps. The other thing I'll say is there really is a lacking of recovery homes for women with children. And currently we're only aware of one organization in the state, and I think they're on the call with us today as well. There are conversations and some good work happening with the possibility of a home here in Barrie for women and children. And Vermont Foundation of Recovery is also looking at some work at Fort Ethan Allen to reunite families as well. So we're really looking at that research and taking it seriously as we try to support the scaling up of this resource.
Thank you, Jeff. That was really some really great information. I appreciate it.
Yeah.
So we also have a couple more questions that have come in. And I think, George, I think you touched on value-free, but I apologize if that was Jeff. But there's a question about what does value-free mean? And if recovery home is faith-based, does that hinder certification for the home? And I guess we'll go to George first.
Well, it doesn't, value-free is a strange phrase because I don't think it's possible to be value-free. But it's the degree to which you are exclusively relying on a recovery pathway that can become the challenge. So it's being clear about what your mission, vision, and values are, and acknowledging that there are some people who may not, their recovery pathway might not coincide with your mission, vision, and values. So part of the initial assessment that goes on when someone applies to come into a recovery residence basically is to ask the question, is this a good match for what recovery capital you're walking in the door with and what your next steps are? So it's not just what's available or affordable, but does it really match where that individual sees themselves headed? Jeff, you want to jump in on this?
We believe that there are many paths to recovery, and so having lots of choices, I think, is really critical. And I noticed that part of the question was being faith-based. Does that impact certification? And we don't discriminate on anything. If it's medically assisted treatment or abstinence-based or all those options we think are really great. And the home providers, you can't discriminate either, but certainly having a focus to offer choice based on what the needs are and what the home can provide, we believe is really, really good.
That's great. Thank you. We had an additional question in the Q&A box for folks are wondering what the name of the organization that allows children in Vermont is, Jeff.
It's Willow Grove, and it's in the central part of the state, down towards White River.
Okay, great. We had a lot of really, looks like good information in the chat box. Thanks to our friends at Turning Point Recovery Center asking about some of the funding support. And George included some information about a SAMHSA grant that is currently open right now. Are there any other additional funding supports, especially for state-specific inquiries in Vermont?
ADAP, through the health department, has worked with some recovery home providers here in the state. I think it's kind of a case-by-case basis, but that might be worth exploring as well. One thing that
George,
I'd like
any other
to
additional?
touch on,
Sure.
I'm sorry, Kristen. One thing I wanted to make sure we hit before we wrap up, we've given you so much information today, they might be saying, all right, what's the down and dirty? How do I get certified? And I'm happy to meet with anybody, anywhere in the state to really get into the details of certification. If people are feeling like they're ready, the application is online. You can submit that with the supporting materials, and that gets the ball rolling. But again, I can't emphasize enough, this really is designed to be a consultative approach. We want to go in, we want to help people prepare to become certified if they need that little bit of extra help. We know that a lot of these homes don't have a house manager or a full-time person working on this, so we can help with that. And there really is no reason not to become certified with that type of approach.
That's great. Thank you. And George, any words of wisdom from you before we wrap up?
I just, again, want to thank Jeff and the others in Vermont who are really pushing this initiative forward. I would encourage you to think about who your other State Department allies are. We've got representatives on the call from, I believe, other state agencies, and I'm guessing some are perhaps with the Department of Corrections or the Parole Board or Probation. I'm not exactly sure what that organization is or that department is in Vermont. But the extent to which your members can develop relationships with their local as well as state representatives will have a huge impact on getting the sort of recognition that leads to sustainable funding that will enhance the quality of your organization and, in turn, the quality of the services that are provided by your certified recovery residents. So I'm suggesting take some time and energy. Yeah, it's about certification, but there's more to doing this work than just getting certified. And that's a real challenge. And I appreciate operators. I mean, there's only 40 hours in a week where we're supposed to be working. And if you run a recovery residence, it's more like, I don't know, 860 hours a week that you work. So the idea of trying to fit something else into the schedule can be a bit of a challenge. But just know that your organization will benefit from developing those allies. Just it's a parallel process to what we're suggesting the new resident do when they come into recovery residence and developing connections with other recovery supports in the community.
Well said. Thank you so much, George. And thank you so much, Jeff. We have placed the webinar slides in the file share pod you should see on your screen now, so you can download those. And we don't have any other questions. I do want to thank everybody who was able to participate today in the session, and look forward to answering any follow-up questions that you may have. So again, thank you so much to our two experts, Jeff and George. Here is the contact information along with our senior housing expert, John Cox, here at C4. So please feel free to reach out if you have any questions, and have a wonderful afternoon. Thank you.